Hi, I'm Jeff Gill, the class of 2013 at the Horry Georgetown Radiology Department. I'm broadcasting live from the X-ray department at Grand Strand Regional Medical Center in room 2. Behind me we have the Swissray Indico 100 series high frequency generator. If you look to my left, we have the X-ray tube, and of course to my right is the X-ray bucky, and they are attached on a C-shaped arm, which is what makes this particular generator unique. I'm going to introduce to you the various control buttons on the tube and bucky on the Indico 100 series. If you look to my left, you'll see the buttons on the tube right here. Right here we have the two vertical collimator buttons, and below we have the two horizontal collimator buttons, and of course up top we have the button which controls the light. So you can position your patient. Right here we have the shift button, which when depressed you can angle the tube cephalad or caudad on the patient. Also over here we have a detachable remote which you can control from anywhere in the room, and of course it has the same buttons up top that you find on the tube and down here that you find on the bucky. Hi again. Down here we have the buttons that are on the bucky control panel. If you notice, we have the up arrow, which will move the bucky up, and the down arrow, which moves the bucky down. These control our whole tube and bucky alignment, which if I push this, the bucky and the tube will angle in the same direction. If I depress the shift, as I talked about earlier, and then push the button, only the tube will move, so that central ray can be angled caudad or cephalad. Here we have the rotate, which it makes it simple as the push of a button and a little movement of the handles. You can switch from portrait to landscape. Simple as that.
Well, hello there. I'm standing next to the Indico 100 series. If you notice right here, here's the data display screen. On it, you can see the dimensions of the film screen size as well as the CR angle. But what I bet you didn't know is it's also a touchscreen control pad. Here you have the vertical and horizontal movement buttons, as well as the vertical movement buttons. We also have the collimator buttons and the light control button. Right here we have the button which will set it up for a table X-ray or for a wall X-ray. And of course our handy little shift button is right here, and when we move over here it shows our number of exposures for the machine, our total exposure time, the system uptime, as well as the use time for all the different controls for it.
Oh, sorry. I'm here on the X-ray table that comes with the Indico 100 series. It's a nice comfortable table, holds up to 350 pounds. It can move in 4 directions, or from head to toe with the flip of a couple foot pedals. It's convenient in that if the patient can't get on the X-ray table themselves, we can move it out in the hallway and put them on this table and wheel them right in. However, it does pose some limitations because when you have to move the tube from like an upright abdomen to a KUB, you have to move the table out of the way, so it requires some maneuvering. But all in all, it's a comfortable table, and if you break a leg, you might just have the chance of a lifetime to lay on the X-ray table. And that'll be it.